Around 1 in 6 people globally, 15 to 20%, have one or more mental or substance use disorders. Globally, this means over 1 billion people in 2016 experienced one. The largest number of people had an anxiety disorder, estimated around 4% of the population. Given the known unreported and poor data coverage of mental health across most countries, but especially within lower income nations, we may even consider this a minimal estimate. Over the past decade, mental illness has risen dramatically, and at the same time, so has prescription drug misuse. These are prescription drugs in almost There are prescription drugs in almost every house in America, so accessibility is almost certain. While it does save lives, as years pass, it has been taking many as well. These two statistics are some that I do not believe get enough attention with their correlation, especially in young adults. In college, these young adults are exposed to a new and vast environment that bring in dangerous opportunities, and something must be done to protect them. Prescription drug misuse and mental illness are two epidemics that are on the rise and must be taken seriously. When these two are combined, it only makes the other more dangerous, especially throughout college students, which is why colleges must take the initiative to bring an end to this outbreak. The reason why I believe that stopping such epidemics is so hard is because of how vast both categories are. When it comes to mental illness, there are tens of hundreds of different mental illnesses that have their own treatment, symptoms, and demographics. Same goes with prescription drug misuse. There are thousands of different stimulants and painkillers that have their own effects, side effects, and treatment to get off them. While there might be more popular drugs or more known illnesses in college, especially, there are so many different niches of students that are exposed to different kinds of things. In an analysis called Prescription Drug Misuse Among Young Adults, looking across youth cultures, they say the misuse of prescription drugs is an active drug trend among young adults. Different prevalence of prescription drug misuse occurs across distinct youth cultures, suggesting that the trend has not diffused equally among young people. These differing rates also suggest that targeted approaches that account for the subculturally rooted differences in attitudes, social norms, and motivations for use among young people in most efficacious. And a lot of the public's eye, in my opinion, they seem to see. In my opinion, they see is wait. In a lot of the public's eye, in my opinion, they see prescription drug misuse. They see prescription drug misuse as these preset name drugs such as Xanax and Adderall, but as shown in the article, it stems much farther. The last sentence is the most important in my opinion because they actually show a solution to what we as society are doing wrong to prevent this epidemic. Understandably, college campuses are filled with thousands of students from all different backgrounds, and there is just not enough time and money to cover all such bases. But this tactic has been the same since the Reagan era of just say no to drugs, yet there has only been a rise. In another study by the journal Community Psychology, it claims the salience of public stigma and one's perceived stress burdens of mental illness disclosure among college students, and particularly men, consistent with the focus of social risk factors that is the hallmark of community psychology. These findings suggest that mental health services for college students may be limited if they do not consider how public stigma and general ideologies inform students' fundamental decisions to acknowledge and address mental health problems. Yay, yay, yay. Another tactic must be made to touch every culture throughout college, and it seems that one big slogan is not going to do the trick. Is not doing the trick. Instead of a specific message for different drugs or cultures must be taken. Instead, a specific message for different drugs or cultures must be made to give information to these wide variety of students with different problems. For different illnesses and even genders, there needs to be an appropriate way of these services in colleges. If colleges see statistics of the rise in mental illness, then they would see that their old ways will not do the trick. The same tactic of just breathe or relax is not enough for people with Um, People with mental illness such as anxiety. Colleges are the ones causing most of these cases, so there is no reason they should not invest as much time to make their students feel happy to learn. Colleges can be a very difficult at times and bring a lot of stress. Me personally, at times, I feel that if I do not do well on an assignment, it is the end of the world because I have such a sense of anxiety. A lot of students cannot take the pressure and might resort to something more serious. Benson meta-analysis goes into deeper dive into why college students misuse stimulant medications. Random effects of meta-analysis found that the rate of stimulant medication misuse among college students was estimated at 17%, and identified several psychological variations of differentiated misusers and non-users, including symptoms of attention and deficit and hyperactivity disorders, problems associated with alcohol use and marijuana use. In college, people are sometimes exposed to different groups and situations they might not be aware of. Some of the biggest factors were ADHD and depression, and in a lot of cases as well, they are coincided. Students will resort to misuse of stimulants just to gain a quick improvement of symptoms. Once again, with the misuse of stimulants, this article tries to show that this leads to a more harmful problem and are a mix of different drugs. Marijuana, tobacco, and alcohol all coincide with the use of these drugs as shown in the analysis. The study does not only talk about the reasons of misuse, but they want to shed light to this so they can move forward and do more research on more relations such as Greek life and other extracurricular activities. While persistent drug abuse can lead to mental illness, it can go both ways. A survey in 2010, they concluded that 6% of American college students exhibited both alcohol abuse, dependence, and non-medical use of prescription drugs, while 11% exhibited alcohol abuse, dependence, and only 14% exhibited non-medical use of prescription drugs only. Among the total sample, students were on average 19 to 20 years old, while 47% male, 67 were white, non-Hispanics, 2 were married, 17 lived in a dorm, and 6 abused or exhibited dependence on marijuana, heroin, cocaine, a hallucinogen, or an inhalant. Along with that statistic, it is added that 1/3 of the respondents had reported a mental illness recently. Even though stimulants oftentimes make an individual feel better for a certain period of time, they can easily neglect the true effects that can occur when taking these types of drugs. Once again, we see another instance where a reputation of mental illness is more susceptible to a future in prescription drug misuse. As a whole, the more we educate at a young age, the better the future will be to encounter mental illness. Yet another problem that arises is the idea that some students will believe that they can self-medicate. It works for one student. If it works for one student, why wouldn't it work for them? Studies estimate that 4 to 14% yearly incidence of non-prescribed stimulants medicate in use of college students, which is higher than the national prevalence of cocaine, hallucinogens, or inhalants use, and approximately double the prevalence of prescribed stimulant use is in this age group. This statistic truly shows the severity of prescription drug crisis, especially in college students. The fact that non-prescribed drugs use is higher than any other sort of drug category shows in which ways we must shift our focus. Non-prescribed makes this an only more dangerous situation. From a young age, you are always told not to touch anything in the pill bottles. Touch any of the pill bottles if you do not know. From a young age, you are always told to not touch any of the pill bottles you do not know. Yet in these college settings, it is almost the opposite, where if someone says it makes them feel a certain way, you follow their hunch and take it. They will also hear a certain reason to take a certain drug and will automatically associate it with themselves to validate the reasoning to take it. This ultimately will lead to even worse results, such as bad grades, and could possibly result in them using other stronger drugs. In the end, the biggest outcome was shown that 81% of non-medical misusers obtain a stimulant from a friend. As previously stated, when you are in college, you are in a whole new environment filled with brand new things for you to try and experience. While you might turn it down in the beginning, you might see people take certain things that will even help them in the long run. And when finals comes along and you are stressed or can't focus, you yourself might turn to these dangerous things just because a friend said so. Your friends In college, you're sometimes the only one telling you what is right and wrong besides yourself. So if someone gets into the wrong crowd or is taught that misusing prescription drugs is the normal thing, the consequences could be unimaginable. The idea of obtaining drugs from a friend should only bring more attention to the fact that people are not being prescribed appropriately because they have enough to go around. In a different report of the University of North Dakota reports, conversely, MPSU, non-prescription drug use, has been on the rise for college students compared to compared to their non-college peers, with prescription stimulants, specifically Ritalin and Adderall, being the only class of drug that have considerably higher rates of use among students than among their non-college counterparts. These findings further support the idea that NSPU serves a unique purpose within the college student population, likely for its academic and cognitive enhancing purposes. A more in-depth exploration of what else may be driving NSPU among college students is necessary. That it is clear that NSPU is noticeably different compared to the use of similar stimulant drugs such as cocaine to the non-medical use of other prescription drugs such as sleeping medication or pain medication. Once again, we see how the college environment is filled with these kinds of incidents and used for academic enhancing. Adderall and Ritalin are two prescription drugs that mainly give to people with ADHD to enhance their focus, yet many of the times we see these students feel that they cannot focus, so they go for a quick fix of taking prescription drugs they are not prescribed. The study goes on to show how different use of synthetic stimulant drugs are from prescription drugs, showing that there needs to be a main focus on this certain type. For people to put these all under one umbrella will not help solve the problem because there are so many different reasons for use and side effects. Examples of cocaine are much different from being able to obtain an Adderall from a friend who has been prescribed. The ways of obtaining such drugs is also another big deal in my opinion. For someone to be able to take their own medication and be able to flip for profit at the same time brings concern to the ones prescribing them. This leads to an even larger problem that was not talked about in the analysis, the idea of how easily accessible prescription drugs are. From a personal standpoint, I can say I have hundreds of leftover pills lying around at my house right now for anyone to take. A lot of them are used for pain as well, which are the most addictive in the prescription drug field. Having a father in law enforcement, I've seen and heard of how harmful these drugs can be, especially for college students. On one end, I realize that they help millions of people a day. Yet on the other hand, the amount of people becoming addicted and even dying to prescription drug misuse is rising too fast for it not to be a topic of discussion. Previously stated, some colleges feel the need to self-medicate to suppress these feelings. Some college students. Some college students feel the need to self-medicate to suppress these feelings that they are getting, yet what we are not acknowledging are these feelings. A lot of the time, the thing you are feeling is much more than a feeling, especially in college students. What the public forgets to put focus on is the amount of mental illnesses in college students. In a report by the American Psychological Association, they concluded that college students are a population particularly vulnerable to stressors. For instance, 43.7% of college students report experiencing above average stress, 11 report tremendous stress, and 30% describing negative impact of stress on academic performances, with female students consistently reporting higher levels of stress than their male counterparts.